Well, great morning, everyone. My name is Jackie.
And I'm Ethan.
And welcome to Plan Well, Live Well. We are your licensed advisors as it relates to insurance,
Retirement.
and real estate. So, on today's show, we have our guest, Mr. Jim Turner. Welcome to Plan Well to Live Well.
Hey,
Thank
Jim,
you.
how you
Nice to
doing?
be here.
Are you where are you shooting from? Your office? Or are you shooting
I am
from?
shooting from my office, and I'm using a virtual background, so we don't actually have brick in the back of my office.
Okay, that's okay. Hey, technology, it is what it is today. Jim, thank you for joining us today. We're going to cue in a little bit of information about you and about our show. We'll be back with you. Okay.
Okay.
Thank you, Jim. So today, for our viewers, we're going to have Jim Turner, certified senior advisor with Interim Healthcare, and we're going to discuss about long-term care, about healthcare with Jim Turner. Thank you, Jim, for joining us and for our viewers today. So, Jim, we wanted to talk to you. We brought you on our show, an interesting piece as it relates to what Jackie and I do. All day in and day out, we service people with insurance, and one of the most important pieces of planning that we do is long-term care insurance planning. And you are in the long-term care service business, and we thought this would be a good and appropriate, you're a good appropriate guest to come on our show and tell us exactly, what is care, what is long-term care, and some of the services that you provide the local community.
Okay. Well, let's start. I guess long-term care has really evolved over the years that I've been in the business. I started in the home care business in 1987. And I joined a company called Caremark Home Healthcare of America. And our business was primarily home infusion, the delivery of complex drugs and nutritionals to folks who are at home or in an alternate site setting. Back then, there were pretty much two different options. You could go to a nursing home, or you could age in place in your home. There were very few continuing care retirement communities. HUD-based independent living facilities were just really coming online. So today we have all sorts of options. While most people prefer to age in place in their homes, there are also more social-oriented options, such as continuing care retirement communities, independent living facilities, assisted living. So our services span that range of options, and we provide that care on a non-medical basis. We just do personal care and support. But to try to make that more valuable, we try to imbue some technology to the process in order to, quite honestly, bring down the cost of care to a degree, because personal care is very expensive, and to improve the quality of life of the individuals that we're working with. So we're trying to both reduce the cost and improve quality of life, which is not an easy task. But I think given the technology that we use and the partners that we have, we're really stepping up to a new standard of care and personal care and support.
That's great. And you mentioned the word aging in place. The training that I've gone to, representing the carriers on the insurance side, they train us to understand people, not just to sell insurance, to understand that what's happening. And my understanding all these years, and especially seeing my family and my clients, is that people prefer to age in place, right? I mean, it is a preferred thing to do, and it's the old trick, the old thing that people do. They take care of themselves at home. Family takes care of themselves at home. But that has changed, right? It's hard for family members to care for their family members at home because they're busy, right? They don't have the resources live far away or other states. And so home care services and aging home is so vital. And I understand that there's so many different technologies now to help that you offer. Can you talk us about some of the technologies that allows people to age at home, other than just the actual care?
Sure. Um, I began in this business about 12, 13 years ago. I bought a franchise after being in the home infusion and disease management space for a long time. And what I wanted to do as I entered the franchise world, I wanted to find a way to make the services that we provide more valuable than the standard. So to differentiate us by the value added concept. And I have to tell you, I was taken aback by the complexity of this otherwise seemingly simple business. Personal care and support is non-medical by definition, and I thought it'd be much easier than the high-tech stuff that I had come from. Than helping people with their meals, activities of daily living, that sort of thing. I thought would be quite simple, but in fact, it's as complex as any endeavor I've ever been involved with. So to find a way to differentiate, I had to really dig and search. How do you differentiate this simple process? And I came across a partner named Alan Teal, MD. Dr. Teal goes by Chip. He runs a company called Full Circle America out of Damariscotta, Maine. And I actually came across Chip after reading his book, Alone and Invisible No More. It's a book about the aging crisis in America and what we're going to do with the 10,000 people a day that are turning 65 up and through the year 2029. As the baby boomers age, we are all hitting that threshold just about at an accelerating rate that I don't know if anyone really ever understood the potential impact. But there are not enough facilities if people even wanted to be in facilities. There are not enough caregivers, particularly post-COVID and what's happened with the labor market there.
Yes, I know.
And Dr. Teal saw all this coming, certainly not the pandemic, but Teal saw this issue and began to apply technology to the support of folks at home 15 years ago. He started with observational monitors, putting cameras that are linked online into folks' homes so you could have an aide there without actually being there. And that does two things. One, it reduces the actual cost, and the cost of an aide in the home can be up to $45, $50 per hour. So the fewer hours that you can provide, the better off for the consumer. The other thing is that there's an independence and a dignity factor. If someone is sitting in your house just staring at you, and some of these folks that we work with live in small apartments, they don't have a lot of extra space. So if an aide is at the home 12 hours a day, it's an encumbering thing, or it's an encumbrance to a degree. So being able to add the technology of the observational cameras, motion sensors, just and using that along with the analysis, and I don't know if I'm using the right term here, but if Betty is at her coffee table every morning at 8:30 having coffee, that's great. If we check in and see Betty's not there, then we need to see what's going on. Reach out to Betty, talk to her, supportive, while not necessarily being right there on top of the client. Dr. Teal continued to develop his work by the insertion of a software platform that he calls the Life Health Record that every client gets. And this is really an important piece. It's built by Dr. Teal for his patients. And that's an important differentiator, because while it looks a lot like an electronic medical record that you would see in a doctor's office, or the health portal that you would get from your insurer, or the hospital that you might go to. This portal is actually exclusively for the patient. Dr. Teal created it as such, and we maintain it for the patient. We're not asking anyone to get involved with the actual technology. We're asking them to allow us to help them make it beneficial to them. So they're not inputting data. They're not having to surf any of the tabs on this very robust platform, but they benefit from it because our aides and our providers all participate in it. That's probably the most profound thing that Dr. Teal has done in the last several years. The creation of this platform and now the insertion of it in the regular process. The goal is to get to a point where the client, the patient, is so entirely centered in the process that if they need specialty pharmacy, if they need a skilled nurse to come in, if they have any other issues such as a behavioral health consult, telemedicine, all of this is right there at their disposal with a very informed database, so that if someone does go to a telemed doctor and someone new, and that's how it quite often works with telemed now, they can look at the patient's profile. They can go back months, even years in some cases, and see what the history is of that client, see what drugs they've been on, what drugs they're still on, what they've been taken off of. All of this creates a very robust picture of the client in the alternate site, aging in place, much more efficiently than anything else out there. I personally have 3 different portals that I've been associated with over the past few years as I go through my own medical issues. And I can tell you that not a single one has been easy to navigate. If you guys have gone through this process, you might agree. If you have a better one, that's great. But what we've seen, me and my family, is that they're very difficult. They're built for the institutions. They're built for the providers, not built for the client. And Teal,
yeah, I remember, Jim. This technology part. My parents are. I think when we get together, you and I, for our breakfast, we talk a lot of personal stuff, and I, know a little bit about your family personally, and my parents are, in their. My dad's going to be 80. My mom is in her late 70s, and during COVID, even though technology is so apparent, I mean, we need technology; it's impossible to be without. Is that like you said, it's designed for the companies, the carriers, the institutions. My parents couldn't get a COVID appointment unless they logged online, and they couldn't see a doctor unless they did some type of video chat. And my dad doesn't even know how to check his email, and it was difficult implementation for them. And so it is important for technology to be there, but it would be good if technology could be a little simpler, or like I know with some of the services that you provide, the aides or the family members could potentially help in the aid of setting up technology. But I do know that some seniors do struggle with technology, but like you said, the institutions need the technology. It's for them more so than it is, for the end user. Jackie, what's some of the comments you have for Jim today?
So just thinking about, Jim, what you just said, if I'm working and I currently have a loved one that's at home, I'm ecstatic about that type of technology where someone is checking in on my loved one while I'm at work, and it gives me that peace of mind and reassurance that, okay, they're okay. So if their routine is the same, if they're at their breakfast table at 8 a.m. having coffee, that their routine is somewhat the same. It's not interrupted. They're comfortable. And then I have the peace of mind while I'm at work that someone else is checking, because I may not have the opportunity to put all eyes on my loved one. So yeah. I'm excited about that. I wish that technology was in place when my mother was.
Well, it's moving forward. I mean, it's moving ahead. I mean, what is? Let's take a big picture approach here. I mean, as a humans, we always needed care, right? I mean, that's what we do. We care for each other. It's not unknown that you're providing care, but what has increased the need of having outside care aging in place versus let's just say 100 years ago or 50 years ago? What changed in our population or in America? I don't know how you can answer that question, but what has changed that requires the need of a third party home care provider versus having my mom or my brother or my kids take care of me?
Well, I think probably the most profound thing has been the longevity of we humans. We're living longer. And there are more of us reaching 70, 80 years old. I don't know the exact number, but the fastest growing segment of our population right now is those over 85 years old, because we are living that much longer. So the need for assistance is going to be there. But as we just said as well, there's a dwindling labor market. Reimbursement is not expanding. We don't have a giant pool of social welfare money that is out there. And frankly, most of the individuals that are reaching this aging in place threshold do not qualify for public assistance, and they're not going to Boca. These are not, not everybody's going to retire to Florida in a beautiful place. Those that are left to live their lives and comfortably and well where they are need these resources, and it's incumbent upon us to provide these services at a fair price and hopefully at a sustainable price, so that we see folks who otherwise don't have a plan. And I know, Ethan, we've talked about this before. So many seniors feel they're okay right up until they're not, and then they're stuck without a plan. They take a fall and they end up in a hospital, and the hospital says, "Gee, Bob, you're living alone, so we don't feel comfortable sending you home. We're going to send you to a rehab for 2 weeks, and then 4 weeks, and then 6 weeks." And without that plan, without that support at home, such as saying, "Oh no, nurse, I've got Interim back at home, and they've been working with me for a year, and I have support in place so that you can send me home, and I'll be well taken care of," and they know what's going on. Too often, and the statistics on this are really nasty. Folks, when they are referred and end up in that skilled nursing facility, they never come back out. That's where they end up. And without a plan, you're in danger of having that happen. And this goes right in line with the stuff that we've discussed. Having long-term care insurance is fantastic, but having a plan on how to use it and stretch it out as much as possible is really, really that much better, that much more effective.
I'm glad you brought that up, because oftentimes when Ethan and I sit with clients and they say, "Oh, well, my kids are going to, or I have an extended family and they're going to help out." And I said, "Understand that I'm not looking to replace your family, Mrs. Jones. I'm offering you a solution that would help extend the services, because if we're all busy and we're all working, how can I stop working to come and attend to your needs, especially if they're doing, say, business hours?" Yeah. So having a plan in place, just like you mentioned, and when I present to them the different options, this can give everyone peace of mind and a better quality of life. I'm still able to continue my workday or maintain my family or my household and still give you the care and the love that you need to fit what your current circumstances. And a long-term care plan or an agency like yourself, Interim, can offer that. And just making people see the bigger picture, see beyond it's too expensive, the objections of it potentially could be too expensive, or I don't want a stranger in my home. It's like an agency like Interim can offer care that I'm not skilled in that area to offer that type of care. Mm-hmm. So that's the struggle that when I'm meeting with folks for the very first time and talking about these gaps in coverage, if they're on Medicare or if they're on a short-term care, long-term care plan with their employer, that those are the gaps that it doesn't offer. So I champion companies like yours, Interim, that can really fill that void. And Ethan, I know you feel probably the same way, or have examples of that.
I mean, this is a really big deal for me, and Jim is in the provider side of it, and I always tell my clients that I'm in the money side. I'm giving you the money. I am not providing the care. You need a completely different entity to help provide the care. A lot of times I find people think that, we have something to do with the care, and I remind them that we're money and the gym is care. And Jim, you said something earlier about you're seeing more and more people who don't qualify for public, we'll say public assistance or welfare. Most
Right.
of it is spending down. They're spending down their assets. Can you, tell me, the difference between, how, or have you seen a person who has spent down their assets and then eventually got on the public system, or the difference between, self-pay or private pay and government pay?
Sure. The Medicare Waiver program in Pennsylvania is the public assistance program for those who need personal care and support. It's designed specifically to keep folks out of long-term care, and it's a well-intended program. And for the most part, um, it's a it's a well-designed program. But it does force folks to reduce their asset level to a very low number. So the spend down that you talk about is very real. Um, and there are things that can interfere with that. We had a client about 3 or 4 years ago who um, spent down all of his assets, and he was receiving 24-hour care. We actually had monitors in there as well. We had cameras in there for security of the family as they had wished. And about 8 months into his care, this man's wife exercised an unknown asset. That whether it was an inheritance or it was some asset that no one had known about, and when they accessed it, it took him out of the waiver program. So they appealed and they appealed, but to no avail. So after about 16 weeks of my agency providing care for free, we had to give him up to the family because the state would not allow him back into the program.
Wow.
It was no fun for us. We took a big loss on that, but it was the right thing to do, quite honestly, at that point. You just don't abandon people. But it's a good example of where the holes in the program can come out of nowhere. Those folks are the beleaguered middle class who have got a home and assets that, maybe it's $200,000 or $300,000. It's hard to spend that down, and with you certainly can't transfer the assets easily. There's a 5-year look back period. I think it's still 5 years that will not permit folks to do that. So they're between a rock and a hard place. Do they want to go into some long-term care facility and just give up all their assets? And I don't think so. That's where the innovative side of our business, I think, comes into play, and the ability to tailor something lower cost that remains in place for as long as the client wishes to remain there. Sooner or later, there's hospice will need to get involved, or perhaps someone will need to go into something that's more 24-hour oriented as they pass. But in the meantime, having resources available that focus specifically on that client's needs, and again, help them with whatever comes next. We always like to say aging should not come as a surprise. So if you've got a plan, if you know that, boy, I'm going to have to worry about falls. I'm going to have to worry about fall risk in my house. Well, then you take that risk away. You go into the house, you senior proof it, so to speak. And
like child proofing it, right?
Exactly. Hey, full circle.
I tell people, I see this all the time. I tell people, we're born like babies, and then we, unfortunately, as we age, we end up like babies.
God willing, there is that full circle.
It's like 100 times more expensive to take care of an older baby. You know what I mean? And
yeah.
That's the reality. And I think, and I look at that as, like you said, the dignity. And what do people want to do. And I actually think part of the reason why for us it's an important job, but it's also for us it's we do a lot of different, we'll say, products and services as it comes to insurance, retirement, investments, and the word long-term care is probably for our agent force and for our customers. It's just such a tough topic to talk about because they don't want to believe that the
Yes.
kids won't take care of them. And the question, well, have you talked to your daughter? And she said, well, she's a nurse. I'm like, well, perfect. She's a nurse. So she's always working. She's so busy. I said, well, what is your daughter going to do? Quit her job? Oh, and then they want to, and it's hard to have that conversation because they turn right off. It's kind of like they turn off because the reality is that they don't want their daughter to quit their job. And they know their daughter is super busy because their daughter can't even come to this appointment that we're having or help her with any single thing. But I know the daughter really loves her and cares for her. But it's a really, really tough, place to be when we are talking to people, I guess, humanizing the fact that they will fall, they will get hurt, and they will need to age in place. So that's just some of my assessment. Another assessment that I have, which is, Jackie hears from her clients, my children would take care of me. And I hear from, I'll use my parents as an example,
Right.
which is a lot of clients, don't put me in a nursing home. Don't put me in a nursing home. Don't put me in any of these communities. And I tell them, and this is, again, I don't have the statistics, that I was like, as many of these continuing care communities and nursing homes that you see out there, 80% of the community is aging in place.
Right.
They are struggling at home on their own or with friends and loved ones.
Mm-hmm.
And there needs to be a plan for you so that you can age in place with dignity, you can age in place with support, and you can, enjoy, and your family, like Jackie said, we're not trying to replace your family. We're just trying to give your son, your daughter, your sister, your brother help because they have their own lives and they have to now take care of your life, which they would love to do, but could a person actually do that? Right?
Absolutely.
So agencies, I feel like in the last 10, 15 years, there's a lot of them, Jim. I mean, how do you, differentiate yourself? Because it seems like a home care agency is popping up all the time. And are they getting private pay money? Are they getting government money? Why are there so many agencies? How can you differentiate yourself between all these agencies that are out there trying to service the community?
Excellent question. Well, the number of agencies has just expanded so rapidly because the need has expanded so rapidly with the aging population. But there's also a need for, I think, there's a need to be more innovative and more progressive. So as the standard model, for example, under the Medicaid waiver, is that a support coordinator will go in and assess the individual and say, oh boy, you need 80 hours of care per week. And this is very much different than most of the people in the industry, but I would look at it and say, okay, well, how can we get away with fewer hours so that the cost burden is less? And with the waiver program, these are hours that are being paid for by taxpayers' money. So we want to make this last as long as possible. There are ways that we can differentiate our services for this population to take hours away and replace them with technology, with the monitoring cameras, with friends and neighbors volunteering to assist. We always look for those options to support and augment our care model. We mentioned some of the technology. All of that certainly is unique to us as a personal care and support agency. So our approach of going not with a strictly minimalist approach, but with a value added approach. And one of the things that Dr. Thiel wrote about in his book, and was one of my favorite chapters in his book, is called The Dignity of Risk. And what that really has to do with is allowing people as they age in place. These are our seniors are some incredible people that living lives of great merit and contribution, and to just once they hit 75 and maybe they're slowing down a little bit, maybe there's onset dementia, it's not the time to turn our backs on them. It's a time to provide them resources to age and live well and take advantage of that time that they've earned. So the dignity of risk is something that Dr. Teal has taught me to imbue into our practice. And I think that it's one of the key differentiators as we go out there. And I'll tell you what, it is not an easy sell sometimes because you get a kind of cockeyed look when you suggest fewer hours and your business is run by an hourly staff. But we feel if you do it right, if you do a better job, that ultimately it will all come out in the wash and you'll have a thriving business. And sooner or later, I'm hoping to have that.
So, Jim, we often think of our conversation is geared toward the senior. Does Interim, or do you see a shift where you're caring for someone that's, say, 50 and under, or 60 and under? If someone needed care, do you have clientele that you cater to that's under the age of 50?
Sure. Our range in clients is probably about, we have a 20-year-old who is chronically ill and disabled. And we've had this individual, when she's about a year and a half now. Among the things we do with a client like that will be helping them get back and forth to college. This one individual is going to Temple, and our aid helps with the transfer back and forth and allowing that person to live as normally as possible within the constraints of their condition. Our oldest client just turned 100, and her caregiver is her 77-year-old son. So we actually work with both of those individuals. One of the things that does happen when you have family members get involved, too often you can see burnout of the caregiver, and the caregiver is harmed before the patient. So there's a lot of attention that has to be paid to that. This 77-year-old son of the individual has chronic issues he deals with on his own. So we use our technology to help him manage that as well while working with his mom to give her about 25 hours a week is what kind of support we offer there. It gives the son time away from his mom. Not that that's awful, but just to be able to live their life, run errands, do stuff that would be important to the 77-year-old, and then come back, be more refreshed, and be able to do a better job for his mom.
So the concept of giving from a cup half full, that's what I always tell people. You can't give from a cup that's half full. So you got to recharge your batteries or replenish.
Exactly. Yes.
If you want to, talk about any programs, anything special going on with Interim Health that you want to tell our viewers, go ahead.
One of the things that we're doing at Interim that is different than anywhere else is trying to work on a membership model for long-term care insurance. And it's a way to, rather than take $5,000 a month and enter an assisted living facility, spend $1,000 per month and have a plan to have personal care and support and management through an agency like Interim. With our partner, Dr. Teal. Dr. Teal will work with any agency in the country to provide this type of innovative support. So we're modeling that in a new way in order to try to package beneficial services around an entirely patient-centered model. We also do the standard personal care and support. We have aides that have been with us for the duration of our existence and are qualified compassionately, qualified as individuals who have learned this business, not just as CNAs, as some of them are, but also as individuals caring for people in their community, volunteerism that turns into a job. Those people that have cared for their grandmother and realize, wow, I've got a knack for this. And they come on board and they become enamored with the opportunity to contribute. So at Interim Healthcare of Lower Bucks, we are a personal care and support agency, non-medical, but we try our very best to insert ourselves in as a patient advocate and a guide through the aging in place process.
Well, thank you very much, Jim. I would definitely appreciate you joining our show today, and I look forward to having breakfast with you soon, and we can chat a little bit more about that.
Thank you for the opportunity, guys. It was fun.
All right, bye-bye.
See you.
Wow.
Yes.
Ethan.
Wow.
So to all of our viewers out there, think about that aging in place, that conversation that we just had with Jim Turner, and what things that you can put in place to complement your care at home. You're not looking to replace that family member. You're just looking to complement the care that they can provide you in your home.
I mean, look, personally, I'll share with you my family structure, and why I think long-term care planning, insurance is one thing, planning is another thing, home care agency is another thing, but it's all within the same scope. Is that, when I was about 16 years old, my grandmother was probably in her 70s, and she slipped in the shower, broke her hip. And my mom at the time was considered part of the sandwich generation. A sandwich generation female was a woman that was working full time, raising a family at home, and had an aging or a sick parent at another home. And she was sandwiched in. And I remember that whole experience of my mom having to drive 30 minutes after work, during work, in the middle of work, after work, before work, to my grandmother's house to try to take care of her and help her out. Got to the point where she needed inpatient rehab. She didn't want to rehab an inpatient. She wanted to be at home. And then she couldn't be home. This is a long time ago. This is about 30 years ago. This is nothing recent. So I was 16 over 30 years ago. And home care agencies were just kind of coming on board. I'm not sure if they were completely fully on board at the time. It was mostly family doing a lot of the work. And I just remember vividly where my mom begged my grandmother to come live with us. And she's like, no, I want my independence. I want my dignity. I want to be home. I don't want to live with you. You're busy. And so my parents, or my mom, got to the point where she had to bring in the care. She had to bring in the care. And it was great at the time because my grandmother did not want to be in a facility. She did not want to be in a nursing home of any kind. And frankly, her situation wasn't that severe that she needed to be in a nursing home, but it was severe enough that she couldn't cook. She couldn't get up the steps. She couldn't stand up. She couldn't bathe herself. And so that's called, custodial care or care of daily living. And then some later point on, my grandmother had a mini stroke and then another stroke. And that brings me to the reality of my parents, whereas when I got into the business sector of insurance and retirement, I went right away to my parents and said, Mom, Dad, look at this thing that I'm involved in. We didn't have that option. We didn't even know that option existed 30 years ago. Let's do some planning. And, as much as I'm the son and I'm the advisor, it was a very, very tough conversation to have because their thing was, don't put me in a nursing home. And I'm like, okay, fine. I won't. But what's the plan? How do we get around it? What do we do? How do we take care of this? And and it's important to have this conversation. So any of our young viewers, any of our older viewers, it's important to have this conversation with your families, and it's important to consider the fact that it's an inevitable thing that you must plan for healthcare, not just hospital and doctor care, which all of us seem to like to plan for, is make sure we have our hospital and doctor healthcare, but this is long-term healthcare, which is not the same. And we had a segment about that, Jackie.
Yes, we did.
But it is not the same. So anything we want to let viewers know before we sign off for the day?
I'll just let the viewers know that because I am an advisor, because I plan, because I've experienced a similar circumstance with an aging parent or two aging parents at one point. They're both gone now, but I too had the difficult conversation with my daughter to let her know I put a plan in place. So, and she lives 2 hours away now and she's married, so she has her own life, But just in case, if I should ever need to activate that particular benefit, I know that, and she knows that we've put a plan in place. We've had the difficult conversations. She's like, "Oh, Mom, you're young." I said, "I know I'm young, but isn't it nice to plan early so we can think about it?" So all you have to do is to think about it. I put something in place for you where you just have to make a phone call.
Right. And planning early, Jackie, as we're
Yes.
signing off, planning early is important. A lot of people feel that they could plan on demand. And yes,
Okay.
you can for certain things, but not when it comes to insurance or
Sure.
planning, because insurance at the moment is a for-profit, meaning that the insurance companies don't want to buy you sick. They want to buy you healthy, and then when you get sick, they'll pay for you. Same thing. I make a lot of these analogies like car insurance. You can't drive without car insurance, get into a car accident, and then buy the car insurance. You have to have car insurance before. So it's important as we understand that planning, like Jackie did and I did. I bought long-term care insurance 15 years ago. Myself. This, when I was in my 30s, people think I'm crazy, but it's not that I'm crazy. It's just that I'm hedging against the fact that when I think, like Jim, our guest, mentioned it, when I think I will need it, I won't be able to get it. So I am hedging the fact that I don't know, maybe I'll have a fall, I'll have a stroke when I'm young. I don't have to be old to have a stroke or have a fall or have an accident. Certainly people connect the dots that long-term care insurance is for old people, but it is not the case. So I hedge my bet, and I thank everybody for being on our show today. And I will let you know that next week's guest is David Hinelin. He's the owner of Dave's Backyard Farms in Huntington Valley. He's a local and organic grocer here. We'll have him on our show. We'll be interested to see. This is going to be our Live Well segment. Interested to see what his thoughts are about local and organic foods, seasoned foods, and how he got into the space. So tune in next week for our guest from Dave's Backyard Farms. And as always, thank you everybody for joining our show today. Go to our YouTube channel, Plan Well to Live Well. Click on the calendar link and book a free consultation with Jackie and myself to talk about insurance, retirement, real estate, and if you have any special topics you want us to discuss, as well as our features guest. Anybody that wants to be a featured guest, a sponsor, an advertiser, please go to our YouTube channel, Plan Well to Live Well. Click on the calendar link to schedule an appointment.
So thank you, everybody, for a great show. Ethan and I would like for you to, as always, when you plan well, you live well.
Thank you, everybody.
Thank you. Great show.